Hi, Dr. Saxena here, and been emphasizing on what exactly is this intestinal health, and yeah, what are the areas. The first thing which we talked about is all the chronic diseases has got a important thing which I try to figure out first. That is that step where I would like to fix the intestinal issue first, then I can always go for the next level. In the intestinal issue also, we in fact we try to work it out with the patients, trying to tell them yes, we need to work. It is very important why you chew the food, and in the last segment I was talking about what is the absorption, what are the different assimilation and all that. So let's we went up to the importance of hydrochloric acid. I just want to talk about something like pancreas. This pancreas is a very important organ which is situated behind the stomach and adjacent to the duodenum. The primary function is the production of enzymes and other components that are necessary for further digestion and absorption of the food. When we call about this particular thing, the pancreas, every day the pancreas releases about 1.5 quarts of digestive enzymes secretions into the small intestines. The three most important secretions are insulin, bicarbonate, and digestive enzymes. Insulin, as you all know, is a hormone that is responsible for the metabolism and proper regulation of the glucose. When the blood sugar levels are high, there is an insulin surge, insulin secreted, and by the pancreas signals the cells to store more glucose, thereby returning the blood sugars to normal levels. Diabetes can result when these regulatory mechanisms fail. All of us are on the same page. The thing which is not much known among the people, which I would like you to understand, is the importance of bicarbonate. Bicarbonate is secreted by the pancreas when food passes from stomach into the duodenum, the first portion of the intestinal small intestines. Bicarbonate is a alkaline substance that neutralizes the chyme. From the stomach you have got hydrochloric acid and the chyme is generated. It's quite acidic kind of stuff. So the role of bicarbonate is trying to neutralize that particular thing. So thereby this bicarbonate buffers this particular chyme, and it protects the delicate lining of the intestinal tract from becoming irritated by the digestive fluid. Bicarbonate production by the pancreas is stimulated by the hormone secretin, which becomes a valuable therapeutic intervention when we worked on children of autism and all. The problem was inadequate secretion of bicarbonate, and someone did a study talking about how secretin can manage this particular thing. Normally, the secretin is released and activated when the acidic chyme from the stomach enters into duodenum. Once activated, this secretin stimulates the pancreas and to release large amounts of bicarbonate. That is one of the important thing this secretin does. Besides acting as a buffering agent to protect the small intestines from the acidity of the stomach juices, bicarbonate serves one more important function, and it proves an ideal environment for pancreatic enzymes to do their job. That is one of the major kind of things. These enzymes, which require not highly, it's a slightly higher alkaline pH in order to function properly, and therefore are highly dependent on availability of both secretin and bicarbonate. So these pancreatic enzymes are essential for continuing the process of digestion already begun in the stomach. We have seen a lot of kids with autism, a lot of people having with chronic diseases and all have already they have these deficiencies in these enzymes. And they often respond extremely well to supplementation of these digestive enzymes. The three most important groups of enzymes secreted by the pancreas are lipases, amylases, and proteases. The function of these different enzymes are lipase enzymes work with bile, bile is liberated by the gallbladder and help in the digestion of fats. Lipase for fats. Lipase deficiency, which appears to be prevalent in many conditions, people with gallbladder disease, people with having post-cholecystectomy, people with autism, and people with some chronic problems. Most I have seen this lipase deficiency a big in most of the chronic conditions, right from your allergy to cancer, and this results in malabsorption of fats and the fat soluble vitamins A, D, E, and K. Clinically, fat. See, whenever there is a deficiency of these nutrients, I would like to know whether there is a fat malabsorption is happening or not. I'd like to see what are the stools, how is it yellow or orange or pale in color. The second enzyme which is being secreted is amylase enzymes. Amylase are usually for carbohydrates and all the digestion. The primary function of this amylase is breaking down of starches into small sugars. As discussed previously, the small amount of amylase is also present in saliva, which makes it as a pre-digested kind of thing. But the primary action of this in amylase happens from the pancreas. There are something else called proteases, which are called protease enzymes, assist in the breakdown of protein digestion. And this group of enzymes appear deficient in autism and other this lack of protease activity can result in problems of food allergies, opioid reactions from gluten casein peptides, and protein malabsorption. In addition to the role of digestive proteins, these enzymes serve a number of other important functions as well. They have antimicrobial activities and help to prevent colonization of small intestine by the bacteria, yeast, and parasites. An individual with protease deficiency is therefore at greater risk of developing intestinal infections, including chronic problems in candida overgrowth. This comes pancreas is such a kind of thing. I've been on a kind of work where we try to give a lot of pancreatic enzymes in people who are having malignancies and all that, and it is there is a big work which was done by Dr. Gonzalez and pancreatic Dr. Burr. There are a big number of people who worked on this, but giving the pancreatic enzymes makes things much easier for all chronic diseases. And I always believe pancreas is this particular has to be properly worked out, and in whatever areas I see there is a chronic issues, right from autism to cancer to all in fact all autoimmune diseases and all that, I try to work looking at pancreas, and I'm very sure, and this is the most neglected part, and this thing which I was trying to tell across, it's not just pancreatic enzymes, it's the insulin, it's the bicarbonate which helps in a big way, and this has to be properly optimized to go for a good health. Thank you.